Hi, I'm Antonia, and I am the host of the Working Moms Playbook. Here, real moms share real stories, building businesses while battling infertility, hitting breastfeeding goals without sacrificing their careers, finding their style as new moms, and so much more. And it's just season 1. Let's jump in because let's face it, moms don't have time to waste. Welcome to the next episode of the Working Moms Playbook. I'm your host, Antonia, and today we're talking about motherhood and movement with Dr. Mae Hughes. Hi, Mae.
Hi, Antonia. Thank you so much for having me.
Oh, thank you so much for coming on. I'm so excited to talk more with you about movement and motherhood and pelvic floor therapy. Having my first over a year ago, it is certainly a topic that even through all of my research, I feel like I didn't research thoroughly enough.
Yeah, I feel like everyone feels that way.
I'm like preparing for all these other sections and labor and birth and postpartum, and somehow pelvic floor therapy didn't make it into my life until I think like my 6-month checkup. The midwife told me, you need to go see a pelvic floor therapist.
I'm so glad she did.
She did, but now I'm on a 3-month waiting list, so we'll see.
Oh, yeah.
But, it goes into the whole part of, from pregnancy to preparing for labor and birth and beyond, like our bodies really go through so much, as you well know, not only as a pelvic floor therapist, but also as a mom to 3.
Yes. I can't believe baby number 3 is on the way. My goodness.
I know. You're doing the spring, correct?
Yeah, another little spring baby. My first was born in the spring, too.
Oh, so exciting. Oh, my goodness. So you have been through this almost 3 times, so you certainly know how to prepare and train your body, especially when it comes to the fact that pelvic floor therapy is just not spoken enough about.
Yes.
You've clearly built such a strong community around women's strength and confidence with that in mind. So what really inspired you first to specialize in pelvic floor and women's health?
I get this question all the time, and it's always so interesting because I never expected to go into pelvic floor physical therapy or women's health. I went into PT school really wanting to do sport and orthopedics, finished physical therapy school, and started a sports residency where I worked with both professional and collegiate level athletes for about a year and a half. And it was actually during that time period that I was working with really high-level female athletes, and they would eventually confide in me that they were having incontinence, maybe while finishing a cross-country race or while doing a box jump or something like that. And I knew from physical therapy school that it was certainly pelvic floor related, but we don't get much training on the pelvic floor in PT school, maybe 1 or 2 lectures, but it's really a specialty you have to pursue after school. And so it was during that residency time period that I was like, you know what? I feel like my care of women, these athletes that I'm treating, is incomplete because I don't have that specific knowledge of the pelvic floor. And that's what started my path down pelvic floor, like the additional pelvic floor training. And then, of course, once I got pregnant myself, then I wanted to do even more specifically geared towards pregnancy and postpartum, and it's really just taken off from there. I've really fallen in love with kind of this niche of the pregnancy and postpartum world, although I do work with women, across the age span, but I do heavily tend to treat more pregnant and postpartum women.
Yeah, I think I love so much, and what led me to you actually was one of my best friends. She was pregnant. She had her baby in the summer, and she had found you and was really into your videos and your advice. And what I think is so cool is that in a world that really doesn't talk about pelvic floor therapy, as we've mentioned, you not only are helping women in person, but you're also reaching so many women across the United States and probably beyond. I think the last time I checked, you had over 350,000 followers, which is so great and making such an impact.
Yes, I still can't believe that. I never anticipated, to grow this following and be able to help this many women. I honestly just started my Instagram account when I started treating the pelvic floor and wanted to get more patients in Nashville, and never anticipated creating an app and the pregnancy programs and just like you said, helping so many women across the world. I never planned it, but I'm so glad. I love it so much.
It's awesome. And I love getting advice from women who are actually like moms and actually get it, right? Like you have your third on the way. Of course you just told me a little bit more about your experience, but then you actually became pregnant and went through the actual experience, which is, as we both know, a whole other rowboat than what we think it's going to be. So how did your experience as a new mom through pregnancy and then also labor and postpartum, how did that shape the way you approach your work today?
It really allowed me to see all of the, I don't want to put it negatively, but the constraints that women have on being able to heal their body postpartum and work out through pregnancy. I mean, especially when I was pregnant with baby number 2 and had to take care of a little one at home, it just really opened my eyes to how little time we have for ourselves. And so how efficient the workouts need to be and how there can't be any fluff in them. Like, we're not trying to just take up time for the sake of time. I cut down my workouts from 60 minutes to 30 minutes because that's all that I really had time for with children now. And how can I make those workouts still so effective at building strength and healing your pelvic floor with the additional constraints of just motherhood? So I think that is probably the biggest change. It just really shifted my viewpoint of how can we be more efficient with the time that we actually have as women? Because beforehand, especially when I was pregnant with number 1, I had all the time in the world. I work in a physical therapy clinic. I can work out, like, a patient cancels, I got a full 60 minutes to work out leisurely on my own.
Yeah.
And that just has really changed since then. And I think a lot of women resonate with that and appreciate that because your whole world just shifts once you become a mom. And so I think the biggest issue we tend to have is not having enough time to pour into ourselves, heal our pelvic floor. So you're not peeing while you jump or while holding your babies and things like that.
Yeah.
But like, how can we do that in a time efficient manner?
It's so true. I mean, I think about pre-pregnancy, like every Sunday we would go to the gym and my husband and I would probably spend like 3 hours at the gym just working out and then in the sauna and then working out again. And then, it was just like so at your own leisure. And then when I was pregnant, there was a whole workout schedule that I was going according to then. Like, I was going to yoga and I had like yin on Thursday nights and I had strength workouts on Wednesdays. And now I'm like, we're lucky enough to have a burn boot camp around the corner where they have a daycare. But I mean, I haven't been to yoga in months just because of the plain fact that you don't have somebody to watch your kid while you're in yoga necessarily. I mean, obviously we have our partners and we have a village if we're lucky enough to have that, but it can be hard, especially at night, to have that and then still come home and eat and go to bed and not feel too rushed to wake up in the morning and do it all over again.
Exactly. Yeah. I'm right there with you.
So then for you, especially in your first pregnancy, but then I think, to talk about it in your second and then even now in your third pregnancy, you're really training for a marathon. And I know you've said that before, and I certainly had that same mindset. What does that training look like for you physically and mentally, especially now as you prepare for your third?
I think a lot of my focus for myself and, as I help other women through pregnancy is really trying to prioritize strength training. So if you are someone who loves cardio and that's like your main form of exercising, I don't necessarily want you to stop because you love it, but I really do want you to start prioritizing strength training, even if that's only like 2 times a week. And I'm not saying you have to go to the gym and pick up a barbell unless of course you want to, but strength training and building muscle mass is what is so important during pregnancy, because when you are postpartum, especially those first 6 weeks when you can't really do much, granted, I don't think you should do nothing, but you're not certainly lifting weights. You do lose quite a bit of muscle mass. And then we talk about all of the time constraints that just postpartum has on being able to rebuild that strength. I feel like I see a ton of women kind of start to really lose their muscle mass and strength after having children. And that path just really accelerates with each subsequent child if you're not able to regain that strength postpartum. There's a statistic out there that women, once you turn 30, you lose about anywhere from 3 to 8% of muscle mass per decade.
Oh, wow.
And that's a huge amount, especially when most women don't think about prioritizing strength training to begin with.
Right.
And so you start losing that muscle mass, and, the cliche of, the frail old woman. Unfortunately, I can see where that comes from now, because you just have so many things piling against you postpartum and into motherhood that it really is hard to prioritize that strength training simply so you can continue doing daily activities. Like, I'm carrying my 3.5-year-old in one arm and my 1-year-old in the other arm while being pregnant up and down the stairs or walking around, because of course they both want to be held at the same time.
Right. Because why would it be any different?
Right. I'm like, oh my gosh, how am I where's the third one? Who's going to carry the third one? But I just think if you can really just get into a routine of strength training during pregnancy, it will pay off dividends postpartum, because you need that muscle mass to do things like prevent urinary incontinence and help heal your diastasis and reduce prolapse. Really, muscle is the foundation for healing all of those dysfunctions.
Can really focusing on strength training while you're pregnant help to minimize those later symptoms of a weakened pelvic floor?
Absolutely. And you might not notice those symptoms, till maybe the second trimester, third trimester. It does tend to occur earlier with each subsequent pregnancy, especially if you haven't, regained your strength. But so many of the common aches and pains, like low back pain and hip pain, back pain, all of those can be mitigated just with basic strength training, because your body changes so much during pregnancy. You're gaining so much weight so quickly that your muscles just can't keep up with that demand. And so there's more load throughout your full body, on your pelvic floor, on your core, on your back, on your hips. And so the more that you can support that muscular system, the less pain you will have throughout your pregnancy, and the better and easier your postpartum recovery will be. Now, obviously, there are always instances in which you can't control things that happen during labor and delivery that might change your postpartum outlook. But 100% I can say that when I have worked with women who have been consistent with being able to build muscle mass during pregnancy, or at least maintain it comes back so much quicker postpartum.
But then at the same merit, or at the same time, I worked out, I was an athlete. There was no one who's going to tell me I couldn't do it. But it is still a common misconception for so many women that they shouldn't be strength training while they're pregnant, especially if they haven't had prior strength training in general. What would you say are some of those most common misconceptions, but then also what your take on that is?
Yeah, I hear this all the time that, my provider told me to just keep doing what I'm doing and, maybe introduce walking, but if you haven't strength trained before, it's not safe to do it now, or don't lift more than 20 pounds. And I'm always going to say with the caveat, there are always going to be certain medical conditions where maybe exercise is contraindicated, but which means that you can't do it. But for most women who are experiencing a healthy pregnancy, you absolutely can continue lifting weights. Honestly, it's even more important to do that if you've never strength trained before, because you are likely going to be someone who experiences more discomfort or more pain or more pelvic floor dysfunction because you don't have that muscular support. So I try and get women who've never strength trained before, first, just build up your walking, 150 minutes a week. That's what the American College of Obstetricians and Gynecologists recommends. Once you are consistently doing just 150 minutes of walking or aerobic activity, swimming, whatever you like, then start layering in just 1 to 2 weeks of strength training, following the guidance of a professional, whether that's, a program like one that I've created, or maybe you go see a pelvic floor physical therapist who has training working with strength training with pregnant women, or maybe you find a personal trainer who has this specialty as well. And it doesn't have to be super heavy at first, right? Your heavy load could just be your body weight at first if you're not used to lifting weight. And then once that becomes relatively easy, then you start introducing lighter dumbbells and you build gradually. But I 100% think women's bodies are capable of more than the general population gives them credit for when they are pregnant. We are capable of so much more than historically we've been told.
Yeah, 100%. And I always feel like it can also, there's the element of the healthcare professional maybe suggesting that you shouldn't. Then there's also, in general, a lot of women can feel very intimidated with strength training just because of all the misconceptions versus empowered by it. So with you training in your own pregnancy and having strength training prior to that, like, how do you think women can look at strength training specifically as more empowering versus so scary, which is what I come across so much?
I think that actually social media has the potential to help with that. And I think that's why my account garnered so much attention so quickly, is because I was showing in real life how I was continuing to lift weights during pregnancy, and they could see that I wasn't experiencing pain. I was talking about my journey. I wasn't experiencing pain, or if I was, it was very minimal, and I knew kind of the exercises to do to or keep the pain away. They were able to see in real life how it affected my postpartum journey and how I was able to regain my strength pretty quickly postpartum. So I think having real life examples where you're able to see the before and the after is definitely helpful. Now, of course, there's some social media accounts that are the complete opposite, and they're super negative, and they're all about bouncing back and like not the best advice. But I would say if you can, find anyone who is pregnant, maybe at the same time as you, it's really helpful to see that journey, or at least someone who's documented it. Because seeing the before and after, I feel like really gives women the confidence that, oh, she's a mom of two. She's working out from the comfort of her own home. Yes, she's lifting dumbbells, but it's not like she's, doing a back squat of 300 pounds or anything. And so it just looks more attainable when you can see that. And honestly, starting just with body weight first, there's nothing wrong with doing body weight exercises, just overall feeling better in your pregnancy. And I think once you get to that point of maybe you're doing it for 3-4 consistent weeks and you really start to feel the effects, that's also where the buy-in comes, where women are like, okay, yeah, this makes sense. This feels great. Like, I'm feeling better in my pregnancy. I can do this.
Yeah, I think that's really important to highlight, like 2 to 3 weeks, right? Or even sometimes longer than that. There is such an emphasis and fixation of immediacy, right? Like immediate results, immediate time back, immediate this, immediate that. And like, in truth, if you want anything in this world to show any kind of growth, no matter what you're looking to do, but especially when it comes to strength training and working out and working on your pelvic floor, like, you can't just do it once a day, like one time a week, and, in 3 weeks, nothing's changed, and you're like, oh, this isn't working for me. Like, you really need to actually focus on it and dedicate that time to it.
Exactly. A bare minimum I tell women is, 2 to 3 times a week. Honestly, maybe 1 to 2 if you're just starting out, because you'll see greater change at a faster rate if you're coming from a low muscular standpoint. But 2 to 3 workouts minimum, and you will start to feel the difference. But it does take consistency. It does take putting in the work, but also knowing that, hey, like 30-minute workout is really all you need. You don't need to be drenched in sweat. You just need to appropriately lift for the muscle group that you're trying to grow or improve or reduce pain.
Yeah. And we get it, right? Like, it doesn't feel like there's enough time in the day. I mean, I'm certainly not waking up at 5 a.m. to work out. That is just not it's not my thing. But I do make sure to make time to do something, even if it's just like a walk, because I'm too tired to go do strength training. Like, just moving your body in general, I feel like can help you create that pattern. So then that way you are able to do more strength training. For those moms listening who are newly postpartum and they are struggling to reconnect with their bodies, so much has changed, where can they start?
I recommend trying to at least just get maybe 15 to 20 minutes per day. And that can be easy exercise from the comfort of your own bed if you're, super early postpartum, or from your living room. But trying to do something when you are in that early postpartum phase every day, or like 5 days a week, even in just 15 to 20 minutes, I find it to be more beneficial than doing, one long workout. Being able to break it up into chunks throughout the day, it helps you establish that habit of like, okay, in the mornings, this is what I do. This is just part of my routine. And it helps you also just to take time for yourself during those difficult postpartum days where you hardly get any time to yourself. So being able to take just 15 minutes a day for yourself will do wonders for not just your physical health, but also your mental health.
Yeah.
And then that usually just works like, it looks like gentle mobility at first, releasing full body tension. Labor is a very physical task. Mm-hmm. And so your body is really tense, and especially your pelvic floor can get really tense, especially if you've had a vaginal delivery, because it's pretty much trying to protect itself from the trauma that was birth. Whether you had, any tearing or not, it's still technically a traumatic event. Your pelvic floor stretches 2 to 3 times its resting length during a vaginal delivery. And same, if you've had a C-section, it's still, obviously, it's a lot more trauma to your abdominal muscles in your abdominal cavity. So being able to release tension earlier on is going to be more helpful for you. I think a lot of people want to jump into strengthening their pelvic floor and their core right away. Mm-hmm. And I understand where that comes from, thinking, my pelvic floor just got stretched out, so I need to tighten it back up. But really, your pelvic floor needs full length before you can begin the strength part. Okay. So full mobility for a couple of weeks, then adding in just gentle activation of like, okay, this is how you actually contract and lift your pelvic floor. This is how you actually engage your deep core, not your six-pack muscle, but the deeper transverse abdominis that lives below that. And that, I think a lot of people want to skip over the foundational parts as postpartum recovery because they're so eager to get back into, whatever their pre-pregnancy body looked like, mm-hmm. or their routine or what have you. And I totally understand that. But the foundational work, at least, 12 weeks of focusing on rehab is going to benefit you so much in the long run, because 12 weeks is a drop in the bucket compared to 50 years of life of dealing with pelvic floor dysfunction.
Not fun.
So that's what I try. Yeah, exactly. I try to get people to at least commit to, let's do at least 12 weeks of rehab. And by the end of those 12 weeks, that rehab might still, it is incorporating weights and jumping, but it's just in a progressive manner.
Yeah, jumping is rough. That is no joke.
It really is.
That was a betrayal, the jumping. That mm-hmm. really is a betrayal. So then, you just talked about the different types of deliveries and how that can obviously create different types of trauma and different kinds of, pelvic floor weakening. But then I look at the stages of pregnancy and then delivery and then postpartum. Do the pelvic floor therapy exercises that you recommend differ depending on what stage you're in?
You mean based off of what delivery you had, or how far postpartum you are?
I mean, I guess if I'm pregnant, would I be doing different pelvic floor therapy exercises to prepare for labor and delivery versus after in postpartum?
Oh, okay. Yes. Yeah. I mean, in general, there's going to be more focus on lengthening of your pelvic floor towards the end of pregnancy, because your pelvic floor needs to be able to lengthen and relax and get out of the way for a vaginal delivery. You mm-hmm. don't want a tight pelvic floor. And so there's a big emphasis towards the end of pregnancy. You're still strength training, but there's even more mobility work that's involved. Mm-hmm. Postpartum, you might start with some of that mobility work the first couple of weeks, but then you do focus more on the mind and muscle connection, the strength training, the building of, rehabbing your core or what have you. Mm-hmm. So there's a little bit of differentiation towards end of pregnancy versus postpartum. But I mean, in general, the pelvic floor works the same whether you're pregnant or postpartum. Obviously there's different demands, but your pelvic floor needs full length, mm-hmm. it needs full strength, and it needs to be able to coordinate with the rest of the body. Right. And that is the same across all ages, all stages, whether you're pregnant or postpartum, maybe you're going through perimenopause or menopause or what have you. Your pelvic floor, there's going to be differences and nuances, but in general, it needs length, strength, and coordination.
Got it. And for any early signs of pelvic floor issues or weakening, is there anything that women can look out for in that regard, but they tend to often ignore?
Yes. I think a lot of women are more aware of that incontinence, leaking, is not normal, despite the memes you might see on the internet of peeing your pants while laughing or running or whatnot. I think more and more women are starting to understand, like, hey, there's something we can do about that. But 100%, if you are leaking past, you know, the first 2 or 3 weeks postpartum, that is 100% a sign of pelvic floor dysfunction. Pelvic heaviness, so a feeling almost of like there's like a tampon or something in your vaginal opening, that is definitely a sign of pelvic floor dysfunction, especially beyond, you know, the first 2-3 weeks postpartum, because those first couple of weeks, everything's going to feel off.
Right.
I mean, there's heaviness, you're still bleeding, you bleed whether you had a vaginal or cesarean delivery. So the first 2 or 3 weeks, there's probably going to be a lot going on. But after that, the heaviness, the incontinence, if you're looking at your abdominal muscles, if you feel like you are still like bloated almost in the lower abdominal region beyond, you know, that early postpartum period, that's definitely a sign of pelvic floor dysfunction. Maybe you're not engaging your lower core appropriately, or maybe you are, and this kind of gets into the nitty gritty, but maybe your pressure management is off. So maybe you're putting more pressure outwards at your belly rather than through dispersing it evenly throughout the rest of your abdominal cavity, like your lower back and your ribs. If you see coning or doming at the midline of your abdominal muscles, it'll truly look like a little tent in the middle of your abdominals.
Oh, wow.
You can, you know, look on YouTube, and I'm sure there's lots of videos of women demonstrating what coning looks like, but that is a sign of improper pressure management. So you're putting too much pressure out at your belly, which can lead to further diastasis. It can lead to pelvic floor issues, because the pelvic floor and decor are very intricately linked. So kind of what goes on at the belly can be a sign of what's going on at the pelvic floor and vice versa. But those are kind of the main ones. And then any kind of pain in and around the pelvis, whether that's low back pain, pubic symphysis pain, pelvic pain, painful intercourse, those are all additional signs that your pelvic floor and core, there's some sort of dysfunction brewing there.
And yet, pelvic floor therapy is just not always a part of standard care.
No, it's not. It's so frustrating.
Why do you think that is? I mean, this goes under an umbrella of so many women's healthcare topics. I mean, like how lactation consultants should be more available to women. It really goes under this whole tent. But why do you think that pelvic floor therapy just is not as available to women, especially post-delivery?
Yeah, I mean, I think unfortunately all boils down to, at least in the U.S., health insurance.
Yeah.
The insurance companies unfortunately kind of dictate things. And if they don't feel like pelvic floor therapy is profitable for them, then they're not going to cover it, or they're not going to promote it. I do think in the last 15 years, there's been an increase of awareness of how helpful pelvic floor therapy can be. But I also think for a while there, pelvic floor therapists weren't doing as much as they are now. There wasn't as much knowledge of how the pelvic floor works with the rest of the body. It was more like they would just prescribe you Kegels and kind of send you along your merry way. And really the tide has turned where it's more of a full body approach now. There's so much more nuance with looking at your ribs and your lower back and your pelvis and all of that. And so I think there is more benefit now, and maybe PTs just haven't done a good job of advocating for the profession either. But when it comes down to it, unfortunately, insurances don't see it as something that's necessary. They definitely don't think pelvic floor therapy during pregnancy is necessary. They want to see that you're having a traumatic issue, like your prolapse is grade 3 or 4 and you can see vaginal tissue outside of your vaginal opening. That's when they're like, oh, okay, I guess we should cover this for surgery or something. Even then, they want to send you right to surgery, which, if you have a grade 4 prolapse, yes, you will be doing surgery, but they don't see the benefit of preventative measures, at least in the U.S. I know lots of other countries do cover pelvic floor therapy. Traditionally, the example I always use is in France. I think they get 12 visits covered immediately postpartum.
Oh, wow. Those lucky mamas.
I know, yeah. And there are other countries too that have better insurance coverage, because I'll get women DMing me from other countries saying oh no, mine was included or something like that. But for the most part, insurance, it all comes down to insurance companies just not seeing it as profitable or necessary.
It can be it is so hard to be a woman in general in today's society, and then you add pregnancy and labor and delivery and then becoming an actual mom on top of it all. And it is, I mean, we obviously love our babies and we're blessed to have them, but it is hard. It is so rough to juggle it all just when you think you were juggling enough as it is. What
really,
would you,
it is.
It's so hard, and the outside resources don't always make it easier, right? Like the second you think that maybe you need a pelvic floor therapist, like you're calling around to you to do the research about who's in network, and then you make the appointment, but it's months out, and it's just, it's a lot.
Yep.
It's a lot of extra work. Your baby's crying in the background as it is, and you still have to make lunch, and you're hungry, and if you're pumping, then you still have to pump, or you have to make a bottle, or you have to breastfeed, and it's just, we have a never-ending list to accomplish on the day-to-day. With that all in mind, a lot of women, of course, look to you as not only an expert in pelvic floor therapy, but you having gone through 2 full pregnancies and going through one now, they look up to you. So what would you say is one empowering message that you want every mom listening to hear today?
Oh man, just one. Just one important empowering message. I mean, I think it still goes back to what I kind of said about during pregnancy, is that the female body is capable of more than we give it credit for. You're capable of healing yourself postpartum. It's not just this is the way it is after having children. Like the body is incredible and capable of so many things. Given the right resources. So I don't want women to feel defeated after childbirth, whether they had an amazing birth and had no complications, or they feel like they had every complication that they possibly could have. I've seen it all. Women are capable of healing.
And we can do it.
Yeah, we sure can. It's just finding the right resources, but we 100% can. Amazing.
Well, thank you so much for sharing your time and wisdom today. I know so many moms listening are going to walk away with it, I think, feeling more seen, encouraged, and maybe even inspired to move their bodies in a new way, especially when it comes to strengthening their pelvic floor. Before we wrap up, I'd love for you to share where listeners can find you, where they can follow along or connect with your work.
Yeah, you can find me on social media, Dr. Mae Hughes, all social media. That's, Instagram, TikTok, YouTube, what have you. And then all things pelvic floor programming, you can go to drmayhughes.com, and there you can find my Movement Through Motherhood app, where I've created pregnancy programs, postpartum programs, and just general daily life fitness programs just to help women build up their pelvic floor and integrate that pelvic floor wellness into their regular strength training routine. So yeah, really drmayhughes.com. That's my main hub. That's where you can find everything. Lots of free resources on there too for those who just are looking for more information. I've got a really extensive blog that I am updating all the time, a ton of free resources. So I try and make women's health as accessible as possible.
That's perfect. And I'm going to definitely look even more into those than I already have. I know I could use some more pelvic floor time in my life. And to everyone tuning in, thank you so much for listening to the Working Moms Playbook. If this episode resonated with you, share it with another mama who could use a little extra motivation or a reminder that she's not alone. And don't forget to hit follow or leave a quick review. It really helps creators like me grow this space for working moms everywhere. I'll see you next week for another real, honest conversation. And until then, remember, it's all about progress and not perfection.